Assalamu alaikum. Decommunication day, first scenario. You are the doctor, the medical registrar in the hepatology clinic. You are about to see Mr. James Fletcher, 42 years old man, recently diagnosed with hepatitis C. He has a past history of drug abuse, IV, but says he quit 2 years ago. He currently drinks alcohol daily. You are asked to discuss treatment option and address his concern as he is reluctant to start antiviral therapy. You can start after sharing timer. Here you go.
Hello, good morning. My name is Dr. Abdurrahman, the doctor in the clinic today. Can I confirm that you are Mr. James Fletcher and your age is 42 years?
Yes, Doctor, I am.
Welcome, Mr. James. So, Mr. James, we are here today to discuss some issues regarding your health condition and to address all your concerns. So, are you okay with that?
Okay, Doctor.
Okay, Mr. James. So, Mr. James, do you prefer anyone to be with you in this discussion today?
No, Doctor, no need.
Okay. So, before we start discussing your health condition, can you tell me how much do you know about your health condition?
Doctor, for a few days I start to feel tummy pain and I come here to the hospital. They said did some blood test and some imaging scan and they said I have a disease called hepatitis C. I don't know what is this. What is it?
Okay,
I come to know more from you.
Okay, I appreciate that, Mr. James, and I hope that I will be ready to answer all your concerns. But firstly, can you tell me what do you expect from this meeting?
I expect some bug infection in my tummy, thing like this. I want to take my medication and go.
Okay, so Mr. James, I appreciate that, and we are going to discuss further about your condition. Yeah, as you mentioned that you came with some symptoms and some investigations has been run to you, and this came up with the diagnosis called hepatitis C. How much do you know exactly about hepatitis C?
Hepatitis C, I don't know anything, doctor. What is this?
Okay. Mr. James, basically, hepatitis C is some sort of bug infection. We call it virus, and this bug infection or virus affecting your liver. Okay, it's not just like normal bug infections. It's some sort of serious bug infection because it is causing too much damage to the liver. And let me draw for you a simple draw to make it clear for you. This is your liver, okay? And the bug infection, the liver is the organ which is responsible for a lot of things in our body, like metabolism of that means making us benefit from the substances that we are using, and the drugs also. When we are taking any drugs, it is going to metabolize here, and then we will benefit from the drug after going to the liver. The problem when this bug infection affect the liver lose its function. And this result in some manifestation like you presented with, like breakdowns, like the tummy pain that you are complaining of, like also reducing the defensive system, because also the liver is dealing with this thing. That is, the defensive system is the system which is defending your body from the bug infections. And when it is affected, this will be affected, unfortunately. So your immune system which is defending your body from the bugs, will be reduced and leaving you vulnerable to other infections. That's why we need to start treatment, by the way, in order to preserve and to preserve the function of the liver. Are you following me?
Yes, doctor. Okay, give me the treatment. Give me the
Yeah.
medication. I will do.
Okay. Marwa, you should be reluctant. Okay. So
Sorry.
it's okay.
Sorry.
This is the main task, Marwa. So
Oh,
what
okay,
we are
doctor.
going to do,
Is it serious? Is serious
uh,
condition, doctor? Is it serious?
yeah, I appreciate your concern, Mr. James. It is a serious condition, as I explained to you now, because it is not affecting only one organ. It is not just a simple bug infection. It is affecting a lot of organs in your body, specifically the defensive system.
Okay, doctor. Why I'm here now?
As I told, that's why, as we discussed, what we need to do now is to include a group of doctors. This group of doctors with multi-specialty, including the infection doctors, the liver doctors, specialized needs, occupational, and whatever you need in your situation. This team will be responsible for your treatment, starting from the medication which fight this virus inside your body. We call it antiviral. These medications, like any other medication, it's very important to save you from this bug infection, but it has some side effects. These different side effects, according to the type of the treatment they will start with you. Some side effects may be simple, some side effects may be worse, but with regular follow-up and close follow-up with the team of management, we will be able to anticipate and treat any side effects that could happen before that. Some side effects like some skin reaction, like skin rash, and it has also some interaction with some medication. So whenever you want to take any new medication, you need to consult your doctor first. Is this okay with you?
Doctor, I'm okay now. I don't feel pain more. I wanted to go. I don't want this medication with this a lot of side effects. I want to go.
Mhm. Yeah, I appreciate your concern, Mr. James. Uh, but I highly recommend you to start this medication, by the way, because the benefits from this medication outweigh any possible side effect, and it's very important because this bug infection is very serious. I'm sorry to tell you that sometimes with the progression of the disease, it can result also in cancer. That is tumor or nasty growth of your liver. That's why I highly recommend you to start this medication, by the way. Is this okay with you now, Mr. James?
I will think in this, doctor. I will think. Give me time
Okay.
to think.
Thank you, Mr. James, for saying that. That's very good from you. So, Mr. James, I need to ask you some questions, if possible, okay?
Okay.
Mr. James, these are private questions. I'm sorry. Do you drink alcohol?
Yes, doctor, I drink alcohol.
How much units per week and for how long?
Actually, I drink about 20 per day.
Mhm. Per day.
Okay.
So, yeah, I want to tell you something, Mr.
Okay.
James. Alcohol has very bad effect in the liver, and actually, whenever we have any liver problem, we highly recommend to cut alcohol. So, can you do that?
Doctor, from start they said this disease come from IV drugs, and I already stopped it. Why you want me to stop alcohol also?
I highly appreciate that, and I am very glad to hear about that. That
1 minute left.
stop that. But again, alcohol is very important to stop in this situation because it might lead to more progression to your disease. So, Mr. James, can you tell me if you have any other concern or regarding this alcohol
Yes,
consumption, or
doctor.
why you cannot
I
do
I
that?
can't I can't. This my only joy in life. I you stop my I already stopped my IV drugs.
Mhm,
Now I only enjoy my alcohol.
mhm. Mr. James, but I am very caring about your life itself. So, as I told you, as we discussed, that this condition is very serious and it might result in development of cancer and it might threaten your life. That's why I highly recommend you to try to stop alcohol. Actually, I want to ask about cage, but the time is. Can we proceed, Dr. Basim?
Okay, I will extend 2 minutes for you. What you want to discuss?
Are you okay with that?
Actually, no,
Uh,
doctor. No.
okay. So, just I can ask you some further question regarding this alcohol, Mr. James. Okay, have you ever felt the need to cut down alcohol before?
Need for cut alcohol? I didn't feel that.
And have you ever feel annoyed about people commenting on your drinking?
Doctor, who care? I'm homeless. Who care for that?
I'm sorry to hear about that. We are going to involve our social workers to help you in this regards. Uh, and have you ever felt guilty about your drinking?
I don't feel guilty for drink.
And do you ever take an early morning drink in order to be able to start the day?
Usually it happens, doctor.
Mhm. So, Mr. James, after this thorough evaluation, I think you need help from a department which can be deal with this. This thing might be very difficult for you to quit alcohol, and because I think you should not be alone in this thing, in this journey, in cutting alcohol. It is threatening your life, and you need help. So I highly recommend you and advise you that we need to refer you to this a special department which can deal with your alcohol drinking and save you and help you in this. Are you okay with that now?
I will think again, doctor. I told you I will think in this, in all of this.
Okay, thank you. Uh,
Thank
any other concern, Mr. James? I think finished scenario, right?
Yes. Yeah, time is up. Okay, well done,
Okay.
Dr. Salma. What do you think about your performance? What do you
I
think?
don't know. I think I took too much time in the beginning. I
Okay.
think I took too
Yeah.
much time.
What about the introduction? Do you think it's wise here to invite
To
someone?
invite somebody. Yes,
Mm.
after I said it, I realized that it's not
Yeah.
wise at all because
Yeah.
hepatitis C is considered like it's HIV and these things so confidential
Notifiable disease. Yeah.
and unnotifiable disease. Yeah,
Mhm.
so that's why I shouldn't do that.
Yeah. Perfect. Plus the HIV drug abuse, which was one of his secret. So it's totally against his confidentiality.
Mm, mm.
Other than this, the introduction was good about your questions. So what's the expectation? How about breaking bad news? Do you think it is in this case need to be like breaking bad news?
Uh, it's a disease counseling more than breaking bad news because the surrogate told me they diagnosed me with hepatitis C.
So she
I
told
need
you.
I need
The other
I
thing,
need to know more. I
yeah.
need to
So
know more about it. If
the
she told me I am waiting for my results, I would
Yeah,
do it
so
like
you,
breaking
you
bad
can,
news. Yeah.
but let's say, or let's assume hepatitis C virus is curable disease nowadays, right?
Yes.
So I think it's not need to be break as a, or broken as a bad news. Okay.
Yeah. Yeah.
Oh, no, let's go to the next point. The explanation you give the possible complication, which is cancer,
Mm-hmm.
breast growth. But what's important and serious also as a complication to hepatitis C virus? What do you think?
Transmission, and I didn't talk about transmission at all.
What about the liver itself?
And damage to the liver,
How?
fall in the immune system,
Mhm.
scarring of the liver, lead
Yes,
to
exactly.
scarring of the liver. Yes. Mm.
Cirrhosis is the most important and the most common complication to hepatitis C and the hepatitis B as well.
Mm-hmm.
You kept saying cancer, however, you didn't mention the cirrhosis at all. The scarring, yes, you're right. The scarring is one of the most common complication.
Mm. I
Each-
forget the word scarring. That's why I replace it with
Yeah,
damage to the liver itself.
okay. Damage
Yeah,
by scarring, you will
by
remember it
scarring.
in two
Yeah.
scenarios, in basis. Either
Mm-hmm.
alcoholic or non-alcoholic liver disease
Mm-hmm.
in communication scenario,
Mm-hmm.
along with lungs, interstitial pulmonary fibrosis, or
Yes.
interstitial lung disease due to connective tissue disease or medication like methotrexate. So
Mm-hmm.
you have to remember this word: scarring
Okay.
of your lungs, scarring of your liver.
Okay.
Okay. Yeah. Apart from that, you explain about the disease, yes, and the need to start the medication.
Mm-hmm.
Suppose he should be reluctant, but Dr. Marwa corrected later. So
Mm-hmm.
she will argue with you how you want to stop everything in my life I'm enjoying.
Mm-hmm.
I already stopped. So as you did, appreciating stopping her alcohol, her drug abuse, and now the time to give up with the alcohol also. We need from you to, what do you think, reduce or cut down?
Cut down, I told. Cut down.
Yes,
cut
exactly.
down
Because
بس
hepatitis.
بس اللي هي اللارج اماونت دي يعني ينفع cut down مرة واحدة
Exactly. So this is the
ولا
point. It should be cut
Mm-hmm.
down and it should be gradually
Mm.
to avoid withdrawal symptoms. But
Yeah.
it's not reduce or moderate the intake. You cannot tell
Mm-hmm.
her or him you have to moderate or reduce the intake amount.
Mm-hmm.
Why? Because already he has the trigger for cirrhosis, which is hepatitis C. The
Yeah.
alcohol will be another trigger and it will augment the effect of hepatitis C.
Mm.
Sorry.
I forget the side effects of the
Medication.
antiviral. That's why I told something from my mind.
No, no. By the
Some
way,
skin reaction. So
yes, 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 you're
yeah.
right.
Mm.
Any medication you don't know the side effect, you can mention like such systemic manifestation or side
Yeah.
effect. Feeling up, unwell, feeling sick, like
Mm.
GI manifestation, which is nausea,
Mm.
vomiting, diarrhea. This is for any
Yeah.
medication. Feeling
Yeah.
unwell, like you are taking medication, so you might have some reaction, which is also feeling unwell.
Mm.
Plus, maybe skin reaction for any medication, new medication, it might happen as well.
Mm.
So if you are lost, you don't know anything about any medication, you can mention those things. Apart from particular or specific side effect, maybe you don't remember them.
Mm.
Okay. I'm not sure about the antiviral. What the name here? Supposed to be interferon, right? In hepatitis C.
Mm. Yeah, that's C.
Yeah.
Yeah. About the reducing alcohol gradually, I refer to the department which deal with cutting alcohol.
Mhm.
Uh, is this be enough, or by saying cut alcohol immediately?
cut
Mm,
under supervision I think
Yes,
under
cut
exactly.
under supervision.
Cannot
Okay.
cut
Mm.
without
Mm,
observation.
mm,
Even she might or he might have withdrawal symptoms, so should be
mm,
monitored for withdrawal symptoms. So the best thing to refer the patient not to let him stop by himself.
By himself. Yes, yes. Mm,
Yeah. The next point you mentioned cage questionnaire.
mm.
I think with such number of alcohol, the patient already alcoholics, right?
Yeah, yeah.
She or
I
yeah.
used it to convince him.
Yes,
يعني
it's
by,
but
mm,
you mention it in good way. The risk and benefit, or the benefit outweigh the risk, or
mm.
it was for the medication, right?
That's what for medication, yes.
Yeah.
Here, just I want to make him realize that he's addict and he needs help.
Hmm. I'm not sure about this way.
Mm,
However, to let him stop it totally
mm.
should be referred to the team, alcoholic specialized team.
Alcoholic team, specialized team.
Yeah,
Okay,
yeah, to help
okay,
him in this. I
yeah.
think yes, the job is very important. She mentioned to you that he is, or yes, he is homeless, sorry, and jobless,
Homeless, yeah,
and
yeah.
you provide already social support.
Social support in this, yes.
Mhm. Yeah. If he told you no, I don't want, I want to be like this, I am already lost. What do you think? How you can convince him? This is not only for this scenario. You can do it in another scenario. If
Uh,
you face someone is losing the interest for the life, he's not caring about his
mm,
condition,
mm.
his health.
Yeah, that means he need mood help also, psychiatric help. But
Okay.
how I will say that, I don't know.
Yeah. What about yeah,
Why? Why do you want to
encourage
do
him to,
that?
yeah, to have good life.
Yeah,
Someone,
yeah.
yeah, someone he needs
over financial support مثلا.
family. You mean family? Looking for his family, right? Anyone in his
Yeah.
family can take care of him, or he's caring for someone in his home or with
Mm,
him, and or his family member, beloved persons. I think
mm,
at this point, yeah, he might, or it might help him to stop and take the medicine, and to be having interest for the life, because
mm.
those person who's dependent on him needs him and needs his support, and he they need his support, and he needs their support.
But he is homeless. He said, I'm homeless. So,
So what about his family? Yes, he's homeless, but he might have a son or
a family.
yeah.
Yeah.
I'm
Yeah.
I'm trying to find solutions for him, but
Mm.
yeah,
The
any
time is
suggestion?
limited.
Yeah, of course, time
Time
is limited.
is limited, yes. It will
What do you
not.
think
I
apart
think
from
I
this?
think
Yes.
apart from offering social service, the time will
Uh-huh.
not allow any other discussion
Yes,
because
exactly.
this, yeah, very difficult.
So it's a matter of convincing, starting, and at the same time stopping the alcohol.
Alcohol, yeah. This is the main task of this.
Yeah,
Reluctant to
exactly.
take the medication, mention to him that the disease is serious. The medication can help prevent the complications that might happen. And then about alcohol, you just you talk to him about. Before I was thinking cutting down, but we can add cut down gradually under supervision. And for that to happen, I will refer you to the Department of the Alcohol Cessation.
Mhm.
Just this is the more important. Beside the explanation of the disease and
Yes,
uh,
exactly.
disease
The
counseling.
complication,
Yeah,
serious
the
complication of.
complication, serious complication. You said scar, so scarring, the low immune system, and
Mhm.
cancer in the end.
Yeah,
And
and
we should talk about
transmission.
transmission. Transmission.
Yes, yes, of course. If
Yeah.
he has,
I
yeah,
forget this. Yeah.
yeah,
Mm.
it might.
I think if this patient like very depressed, he has sign of depression, we can offer mental health,
Yes.
mental health team to see.
Yes.
You can offer for him. Do you think you need some help from our mental health? They are a specialized team. They can help you in. You can talk to them. They will understand you more, and they may help you in your condition. So if you ask him, ask the mental health team to see him, it will be also good idea for a patient like depressed. Now he's depressed. That's why he need to he want to keep having the alcohol and everything, and he will not respond because he think his life is not worth. So
Yeah.
I think mental health need to be.
I think the opportunity to offer this help will come when we ask him to cut down alcohol under supervision. Then he will say no. Then in this situation, I will ask why. Then he will say because I am مثلا depressed or something. Then I will offer him help in this situation. But I cannot just offer him without knowing his problem or by in social asking him about his mood.
Yeah.
Yeah.
If he told you I lost interest,
Yeah.
for example.
Can
Yeah.
we over test for another infectious disease like HIV or hepatitis B in this scenario?
I
It
don't.
is not the task.
Yes, I don't think.
If the patient is benign and accepting anything and you have time,
I
you
think
can do
they
that.
did. They didn't trust the scenario. They did it. Surely they did. If they did hepatitis C, they did all the virology.
Dr.
Yes,
Salman,
doctor. Yes.
regarding this, we talk in details about this alcohol, and you want to make him is guilty. Any, just you bring this from any guideline, any things, or you are thinking just about it? Because I didn't hear about it. And also another question: there is any cessation alcohol clinic like smoking to refer to it, or no? Thank you.
Yes, of course, there is an alcohol addict. Dr. Maida, what is the name of this clinic? Dr. Maida is here?
She mentioned at
Advice.
session. Yeah,
Alcohol
no,
advice.
alcohol nurse.
Alcohol
Alcohol
nurse. We refer to alcohol nurse.
Alcohol nurse. Alcohol nurse. Okay. So let us just memorize it like that. Alcohol nurse.
Yeah.
So
Or a
this
specialized team. Anyone lost and stuck with the team name, he can say specialized team concerned with this or assigned for this. Okay.
About questions of cage, these are questions to evaluate if the patient is addict or not. So I asked him these questions because he is drinking 20 units per week and he is alcoholic and he refused to stop alcohol. So I asked him these questions in order to convince him that he is addict. By answering these questions, he will feel that he is addict. But I agree with Dr. Basim, the time will not allow for this in the exam.
Yes, I agree too.
Dr. Basim, give me 2 minutes extra to do this. So let us
this, I
just
think,
forget about it,
we
Dr.
have
Muhammad.
Yes, there is two options. As you tell, you refer to clinic, and another things we can involve our consultant. Any reluctant, if patient not insisting, finally we can add the consultant way.
Try to make it the last thing and try to make yourself about to die because you are offering this. Make it last thing. So the patient every time he's telling me, I will think of it, خلاص. No need to refer to consultant. He said, خلاص. Okay.
Yes, because another brand that tell consultant they're always busy there, not like our consultant.
Yeah, not like our consultant. But if the patient told me, no, I will not stop alcohol. No, I will not go to the clinic. No. Do you think that, do you agree if I make another meeting with our consultant, maybe you will see the situation from another perspective or something, just like this.
Reluctance, but Dr. Marwa is calm with you because the main task is the reluctant. Maybe he will go this way. Thank you.
Okay. Thank you.
Okay, thank you too. Dr. Miral, you want to ask?
No. I opened here on Google and said that abrupt cessation of alcohol intake in individuals that have alcohol use disorder by giving some drugs that have the effect similar to the effect of alcohol in order to lessen the symptoms.
Chlordiazepoxide, I think, yes. This is the same medication.
Yes, it's called alcohol detoxification program or alcohol rehabilitation program. Okay, and written here abrupt. Abrupt, this is gradual or sudden? Sudden, I think.
No, sudden, abrupt, sudden.
So what I meant to say that they are stopping them suddenly from alcohol and they're giving them medications have the same effect. Yeah, in order to lessen to reduce the symptoms of alcohol withdrawal.
Yeah,
Exactly.
I think Dr. Miral, that's why it is more safer for us to refer, to tell the patient that we are going to refer you because we think that you need help in this situation. Maybe you cannot do it by yourself.
Exactly.
So yeah, so we will refer you to somebody who will help you, like alcohol nurse or alcohol cessation department or whatever.
Yes, this alcohol abuse came to me in the exam. Okay. And in the feedback, they commented that you must, he is giving, in my case, he was a myocardial infarction patient. So you should talk about effect of alcohol on the heart. So it causes cardiomyopathy. They commented that I didn't give the full information to the patient about the effect of alcohol on the heart. I said it will have it will harm you or have bad effect on you. The commented they need me to say it will cause for you cardiomyopathy, and you are your heart is already weak because you had this myocardial infarction, so it may affect badly on your heart, causing some failure on your heart muscle. The same here, you should comment on the effect of alcohol on the liver, because the case about the liver hepatitis C. So as Dr. Basim said, this expression scarring of the liver,
On the liver.
affecting the function of your liver may cause malfunctioning of your liver. So,
yeah. Thank you for adding this information. This is very valuable, Dr. Miral. Thank you so much.
yes, and the patient was the concern in the exam. He is insisting on going back home. So it's not it's not recommended for you to go back home, as you mentioned, because you need to be under supervision with this alcohol rehabilitation program with our team. They are team, including the psychiatrist, mood doctor, and yeah, and also he was he also another concern. So you will detaining me. You will detain me from going back home. I said no, but I will arrange a meeting with you with the consultant, and this was good. Not bad in the interview.
Okay.
Yeah, anytime you stuck with the surrogate, you can offer a meeting with the consultant. He has a proper way to convince you. He can sit with you to convince you. He's in better position to convince you like that, okay?
Yes, this experience we love in the exam, exactly.
Yes, any scenario.
I think Dr. Basim, the recent exam, in recent exams in Gulf, there is one case. They are telling that the patient, the same case came to Dr. Miral, because yes, he came with myocardial infarction, I think, or something, and then they want to keep him in the hospital to give the diazoxide, and he refused to. I think this is your case, Dr. Miral.
Yes, it was.
Yeah,
So
it came recently in the Gulf, the same case that you are discussing now.
Yes.
Yes, the same case. It was a combined case, post BCI, and he asked me directly what is the medications, and because of stress, I mentioned about beta blocker and the ACE. I didn't mention about this blood thinners, and they commented in the feedback. Blood thinners didn't mention. Okay, so they are commenting on each step. So this yeah والله يعني so BCI post BCI and another thing he was alcoholic. They wanted the relation of alcoholic on the heart itself, not
the heart
generally.
itself.
No. Yeah, they wanted that.
Yeah, now we know the case. Yes, it is. You posted it, Dr. Basim, in the group a few days ago. Patient came with myocardial infarction and have VCI, and then they want to keep him in the hospital to give the isobuxide, and he refused. It's the same case of. So the steps of this case would be first discuss about the VCI and things, and then ask him about alcohol, and then convince him to stay to take the medication for the
And I wrote
withdrawal.
outside, yes, I wrote outside that I need to upgrade his medication because his hemoglobin A1C is not well. The case was having many points, a lot of points. Hemoglobin A1C wasn't under control, and he was on one medication. So he wanted from you to upgrade his medications or even start him on insulin. And because of stress, I didn't mention that. They commented on that. Every single step I forgot. They
Okay.
So they have
Thank you for sharing that.
concerns, and every concern you will be judged on.
How many marks they deduct, Doctor, please, about these points that
because
you missed?
I'm talking. I was talking nicely. They gave me 10 or 11, I think. But all of these
because
are
I think I think if the scenario is too long like that, they should like skip something.
No, but 6 degrees in 16, it's a lot. No, they deducted a lot of marks. The other case, my performance was better, but this case I missed a lot. So they deducted.
It is better to prepare this before entering the station, to write what you in your mind in front of you.
No way you will be perfect. Yes, no way you will be perfect, except you will be prepared outside.
Yes. Yeah, good luck, John.
Okay, thank you, Dr. Dina, for sharing this scenario with us. Any other comment before moving to the next scenario? So the idea is similar. Each scenario, what is the hazards of this on that, how you can address this, how you can convince. I think this is the way how to communicate in any communication scenario. If you don't have clear information or you are not sure about something to mention, so either to refer to the specialized team or to arrange a meeting with your consultant. This is when you stuck with the surrogate. Okay, let's go to the next scenario if no questions. Dr. Marwa, you read the scenario earlier, right?
Yes.
Okay, so I will read it for the for the meeting, I mean. Mrs. Mary, 40 years old, has been complaining of recurrent headaches and tiredness for the last 2 years. 2 days ago, she suffered a lower limb paralysis for about an hour, then recovered completely without any residual symptoms. All investigations came back normal, and the consultant decided that there is no need for further investigation. Go and discuss the condition with Mrs. Mary and update her about her condition and management plan. If you're ready, we can start.
Okay. Hello, good morning.
Here you go.
Good morning.
My name is Dr. Marwa, one of the doctors in the clinic today. Can I confirm you are Mrs. Mary and you are 40 years old?
Yes, I am. I am Mary.
Hello, Mrs. Mary. Do you need anyone to attend our meeting today?
No, I'm okay.
Okay. For starting, can you tell me what you know about your condition?
Actually, doctor, I have been suffering from these headaches for the past 2 years or even more. And every time I came to the doctors, they do their test and they said that there is nothing. And they give me some painkillers, but the headaches keep coming and going. And 2 days ago, I have complete paralysis. I couldn't move. I couldn't move at all. I tried everything, but I couldn't move at all. But then that lasted for 1 hour, and then suddenly I started to move. When I came to the doctors, they did some investigations, and I am waiting for the results now.
I'm sorry, Mrs. Mary, for what happened to you. Do you have any pain now? Do you need any painkiller?
No, I'm okay now.
Okay. Actually, as you said, we did some investigations and scanning to you, and fortunately, all came normal. And
Yes, doctor, that's what doctor's saying every time. Everything is normal, everything is normal. But I'm telling you, there is something abnormal with me.
uh, I highly appreciate your feeling that you are not in good state. But until now, all investigation came back normal. But there may be some underlying causes that may you're not aware of them.
Yeah, I'm not aware. That is clear. But you should be aware of this. What is wrong with me?
Uh, can I ask you some questions, Mrs. Mary? What
Yes.
what do you do for living?
I'm accountant.
Do you have any kids?
Yes, I have kids.
Do you suffer from any stress in your life regarding to
Too
your
much.
job or your kids?
Too much, too much, too much. I am struggling with my kids and with my mother with me in the house. I'm divorced. 2 years ago, my husband just left us, and I'm suffering too much in the house and in the job. But and on top of that, I have these headaches. So, what is the relation between this and
Uh,
my problem?
I'm sorry for what you said, Mrs. Mary. It looks very struggling and very hard for you.
Mhm.
Actually, sometimes this stress affecting uh, our body in different ways. Some of these ways they looks like illness, but it's actually due to the stress, the mental stress.
So,
Regarding
doctor,
this,
you are saying that I am mad?
no, Mrs. Mary, it's not like this. You know, you are not mad, but everybody can expose to this kind of illness. That uh, the mental stress on your life or social life may affect the body, your organs, and your body, and you actually feel the illness and the tiredness and the pain in your head. You feel it really.
Yes, I feel them
Uh,
really.
mm.
But I'm not faking them. I feel them
Yes,
really.
I know.
That's why I
Yes, I
want
know.
to know why that's happening to me.
This due to the effect of stress on your body, uh, expressed by these symptoms. The medical team regarding this decided not to start any type of medication, but there's maybe other methods we can help you by them.
How you are saying they decide not to start any type of medication? Doctor, I'm not convinced with that. I'm having headache, and then I'm having inability to move. That means I might have some uh, cancer in my brain. They didn't do scan of my brain. I need them to do scan of my brain.
I highly appreciate your concern, Mrs. Mary, and I can feel your pain and your suffering and your upset from this result. But to help you, probably we need to solve the main problem in your condition, which is the stress you're suffering from in your life.
Doctor,
regarding
I'm
this,
adapted to this stress. I'm adapted to it. I have this stress since long time. As I told you, my husband left me, and suddenly he disappeared, and making me take care of my kids and my mother, and she's sick. I'm adapted to this.
do you feel, do you think it is not much load on you? Do you think
Yeah,
it is
well, doctor, you are
okay?
right. You are right, doctor. I feel like this is very too much for me.
So we need to modify this stress and make it less. And we need you need to be helped in this issue. So
And how
we
can
can
you help me?
yes, we can help you by involve our social workers and also our psychiatrist team uh, to sit with you and listen from you and try to think with you to solve these problems and how to help you by any method,
So
either
your
by
consultant is throwing me to the uh, mad doctors. That's it.
I'm sorry, Mrs. Mary, you feel like this, but it's not actually not like this because we want to help you in proper way. And we see that giving you medication, chemical formula, chemical medication will not help you, as there is no defect in physiological, I mean functional. I-
2 minutes left.
are you with me, Mrs. Mary? Are you understanding me? Is it clear
Yes,
for
I
you?
am with you. I am with you. You are saying that no medications will be given to me.
Yes, I said that, but I said that's because this medication will not help you, and we need to help you. We want to help you by another method. This method including social and psychiatrist team.
Mhm.
What you how you think about this?
I don't know.
Do you need time to think, or
Okay. So you are going
do you
to
have?
send
Mm,
me to this psychiatrist.
we will involve them in your treating team.
Okay.
Do you have any concern until now?
Uh, I am struggling too much in the house, and you said you can offer me help. Which kind of help I can get from you?
We will discuss this with the social team. They may offer some help by uh, maybe like financial support or may have another thing I don't know now. But
You don't
what
know.
I sure of they will help you.
Okay, doctor. Thank you.
Thank you, Mrs. Mary. Mrs. Mary, do you smoke?
Yes,
How many cigarettes for how long?
I'm smoking about 10 cigarettes per day for the last 2 years.
I highly recommend. I encourage you to try to stop smoking as it affect you badly for your general health and for your kids the same at the same time. Do you if you face any problem to decrease the smoking or stopping it, may I refer you to the smoking cessation clinic if you don't mind.
Thank you, doctor.
Do you drink alcohol?
Yes, doctor.
Uh, uh, for how many units per week?
I'm drinking every day, but within the limit, like 7 units per week or something.
That is good to keep the consumption of alcohol within limits.
Okay.
Do you have any concern, Mrs. Mary?
No, thank you.
Thank you.
Okay, time is up. I added 1 minute more to address the alcohol and social support. Dr. Salma, you can comment now. Well done, by the way, Dr. Marwa.
Well done, Dr. Marwa. Well done.
Yeah.
So the introduction was good. I'm always hesitated about inviting someone. I cannot judge inviting someone. So I believe here, no problem with this, right? Right?
Especially in this case, she needs all support.
Some support.
Yeah.
I don't know. Okay. You ask about, do you have any stress? And that is good. But you did not ask about her mood and if she's thinking that life is worthing, and if she think at any point that she want to take harm herself or take yani evaluate the about because she is psychiatrist psychiatric case now. It's not completely psychiatric, but yani this is a functional disorder, or I don't know, conversion it will be, because there is paralysis also here. So you need to evaluate about her mood and suicidal ideation and suicidal attempt. So this is number one. Number two, you said no medication will be given to you. No medication. Actually, the psychiatrist can provide for her antipsychotics, right? Mood. What is this? Stabilizers, anything. So you just antidepressants.
From our
Yes.
side.
Yeah.
I said from our side.
Yeah, you can just say that they will provide you with different modality of treatment, including this cognitive behavior therapy, which is a medical term for a professional way of talking and discussing your stress and analyzing them in order to find a way to help you. This is number one. Number two, your condition might need also some medications to stabilize your mood and make you feel more comfortable and stress-free. So these two kinds of treatment. I believe mentioning cognitive behavioral therapy by name is good, and then explain it. It's a way of treatment, yeah. Okay. About her headache. About her headache, she's concerned
Dr.
about.
Salma,
She said, yes.
Can you complete way of treatment, the cognitive behavioral therapy? How to explain?
It's a way of treatment, including a professional way of speaking to you or talking to you, analyze your stress and causes of stress, and finding a way by this analysis to help you and to remove or release this stress. Talking, but don't say talkative.
No, talking.
Talkative
Yes.
therapy, yeah. Just explain it. You mention the name and explain this name. And you might need some medication also to stabilize your mood. Okay? Then you make me forget the other. About headaches. She mentioned to you that I have headache and I am concerning about tumor. You tell her that actually after the thorough investigations and evaluation that done by the our consultant and the treating team, they decided that you don't need any further investigation. That means they rule out any serious conditions that you might be you might be thinking of. But this headache is also related to your stresses. It is called tension headache, and it is the headache that we happen to us when we are having too much stress in our life. It is actually some kind of the body of reflecting the stress that you are going through. It doesn't need a scan to your brain, and a scan have too much side effects. We don't want you to be subjected to radiation without any reason or benefits. So you mentioned that the disadvantage and that she don't need it. Like this, you will convince her more. But otherwise, everything was good.
Yes,
Thank you, Dr. Sam.
perfect, Dr. Salma. So as I wrote in the chat box, this scenario fitting any functional disorder, either functional epilepsy scenario, tension headache scenario, irritable bowel syndrome scenario, conversion disorder scenario. So you can discuss in the same way. What's stress in your condition and in your life? How can we address it? Any help you need, particular help, any support. So only support the patient and let him relax while talking with you. You can solve this problem after solving his stress in his life, whatever the reason of the stress, family, financial, job, even
طب
overwork. Yes.
how answer her when she said how they help me in the daily activity in home? How to answer
According to
her?
her job, what's the job?
She said in home.
At home?
Yeah,
Ah,
I said that at home, just just offer social services.
mm,
Without mentioning anything, I'm going to refer you to the social department. They will see what they can do in your situation and help
mm.
you in a better way. Just.
I think this is not social thing, not
Mhm.
social referral, because stress, it's common. Everyone is stressed. The thing is that I think it's a good idea to identify if you give her a diagnosis, tension headache,
Mhm.
you need to describe or to identify for how what is the tension headache, what happened, like for example tension headache is a when you have this tension headache, it's about there is tension in your muscle of the head. This is normally happen and when we have a stressful life, and you give her some uh, reassurance, like normalize the experience for her and explain that the tension is the muscle of the neck and the shoulder, and scalp can be trigger stress and cause this headache. And then you need to give her treatment for that, like you can give her some short painkillers like paracetamol. I can offer her paracetamol. I can give her some stress management, like I will tell her about relaxation technique, that by deep breath and progressive muscle relaxation, meditations as well. You can help her. You can tell her that she can do meditation. This can help her stress because and also CBT, the cognitive behavior therapy, is very important in this case. So you give her this solution of social, because everyone, even us as doctors, we are stressed at home, and so this will not be everyone have the social benefit from that, unless she has issues and she need like how this tension or how far she's stressed is her family, that she has some of her kids have special needs, or one of her family have a special need a carer or something like that. But
Yeah.
if not,
Yes,
Yeah.
I agree.
Yes, I agree. I agree with you. Yes, but because I mentioned that my mother is sick, and my children, I am taking care of my children alone, and my mother, in the middle of the scenario. That's why.
that
But
how
what you
sick,
said, yeah, but
how sick the muscle if she
mm,
cannot care about herself, that need special care, she need a carer,
okay,
something
I
like that.
understand you.
But
That's your point. Yeah.
just tension, because there is a lot of things going together. Because if
Mhm.
you think about the scenario in our real life, even you, me, this is this, we are in the same scenario, yeah.
Yes,
So
exactly. Yeah.
you cannot
Yes,
offer
exactly.
everyone, you cannot offer everyone social
Yes,
support.
Yes,
you cannot
yes.
go to the hospital asking for some
Yeah,
social
The
support
social
to help you at
service.
home.
yeah.
Wallahi, you
Exactly.
can find social
You know,
service.
the best way and the best
It will
solution,
be
Dr.
good.
Salma and Dr. Mayada, is the vacation. So you can say, take a vacation for yourself and with your family, take a rest,
Yeah.
go and relax somewhere,
Actually, Dr. Basim, when I
go to
did the
Maldives.
scenario by myself, I
Yes,
did like Dr. Maida said. I told her you need to relax more, you need to exercise more,
exactly.
even yoga, I recommend
Yes.
you a healthy lifestyle,
Exactly.
mind your diet, eat more vegetables, and do some exercises, because exercises will trigger some substance in your brain, which will help you and relax you more. I did that in my in my scenario when I did the scenario. But there was time in my scenario. For Dr. Marwa, the time was less because of the concerns and the reluctance of the patient. But if you have time, it's better to mention this, yes. Like Dr. Maida said, yes.
I think this came before the patient. The patient. Yes, she was working in stroke unit. She was a technician, and she was overwhelmed with I think sick or ill relatives, her mother, her kids. So it's I think it's okay to offer social services. They are it's important there. Yani, they are offering social help in this regard when she is not able to compensate between her work and her home activities or home jobs. And the case was she was working in stroke unit because it was like conversion disorder, because she started to complain that her right side is not moving. She
Like her
started,
patients.
yes, she started to
Yeah.
apply the complaints that she is seeing every single day on herself, like conversion.
Mm.
But she when you explore more about her social life, you found that she's overwhelmed with yes, sick or ill kid, and her mother as well, and she is the only one who is taking care of them beside her job, which is stressful as well. So yeah, offer social help, of course.
Yeah.
Yeah, according to the case, if
Exactly.
the mother have if the mother ill, what type of illness is she's not mobilized, she has a problem. The mother is herself. They can offer for her someone to help. If she has autism, for example, babies, something special, need help, they will offer that.
Yeah.
But for stress itself, maybe they will say decrease hour of work, because here there is availability that if you are overwhelmed, you can decrease your hour of work, like working 40% or 50% or whatever, according to the how this can help you if you have full-time job and this makes stress on you.
Yes.
There-
And it's important to tell your patients that we are admitting that it's a well-known condition called functional disorder, and we are admitting that your symptoms are real. It's real symptoms, and we need to deal with that. You may need some sessions with a specialist for that, or even up to medications. So tell your patients that you are she's not faking her symptoms, yeah, because this will be the discussion inside the exam. You mean that I'm not I'm faking my symptoms, it's not real, or thing like that.
Yes.
Yes, exactly. You're right, Dr. Dina. We have to admit the patient's symptoms he has, and we believe on you. And we were trying to help you in this, reassuring her that nothing alarming. If you can add some alarming signs at the end, it could be better, like feeling more weak than before, or the weakness different than before. These things will help to get good mark, mean that you are caring for the future.
But if we say this red flags,
Safety
she
netting.
will be more excited,
Safety netting. Nice. Yeah.
more worry.
Safety netting, I think.
yeah, this is very important.
But
This is very important, Dr. Bassem. You ask the patient that if anything new happened that worrying you always
she
are always
she is already worry for anything. She will be more worry.
That's why we need to explain the symptoms. When you say that you have tension headache, what causing it, and you normalize it for her. That's most of the people, most of our patients have these symptoms, and there is a lot of patients we saw. They are going through the same scenario, and your worries about cancer is really appreciated, but we are not quite worried because your investigation not tell us that. So you, as you said, that's you will tell her that your symptom is real. We agreed that, but there is something else, and this is how it happened. And when you how it happened, and you give her solutions. And after that, I think if she convinced, that's okay. If it's not, she's not convinced, it will be very difficult scenario. Yeah? But it's still, you will go through everything to the patient.
Yes. Yes. So the main task here, Dr. Marwa, this is conversion disorder. You have to mention to the patient the name of her disease and explain to her that this is a real disease and your symptoms are real. We admit that, but the management will be different. You will be under the care of group of doctors, including this mood doctor. You explain to her, and he will offer to you multiple solutions for your problem to release the stress, which make your body react like this and give you these symptoms. And then discuss to her that the management will include this cognitive behavioral therapy. You have to mention this, and maybe some medications, and then answer her concerns. And this is the main topic, I think. Do you agree with me, everybody?
Yes,
Yeah, sure.
the concern, yes, only concern regarding she may insist on doing imaging in the exam. So you may tell her there is no in the time being there is no indication for imaging for the time being. But if you feel like that, any weakness, any please come back to us. And some safety netting, then you can tell her that we took this decision in your best interest. There is no need to make you expose to unnecessary radiation. So because in that situation, the complications or the bad outweigh the benefit or
the
good
risk.
condition. Yeah, they love these expressions in your best interest. مش عارفة يعني.
Yes, exactly. And unnecessary tests would get risk rather than getting the benefit of this test. So that's
Safety netting here, I think it's not important because she will feel them. If you we will mention them to her, she will feel them only.
if she insists that I'm worried about something maybe serious, you can tell her about the serious manifestation. And if you feel like this, you can come to us again. Since
She
you
may
have
feel she feel paralysis, and she may feel anything.
no, but the paralysis now, for example, in one side. If she feel, for example, weakness in both legs, or she feel double vision, something different than the manifestation she presented with. This time you have to alarm her something is cooking, and you have to come to us to reassess you again.
Mm.
Okay.
I think no need, Dr. Basim, for this. In the scenario, they didn't mention
Yeah,
they
it's not
didn't
a
mention
secret,
the
but
safety netting because the
always
patient already is
Obsessive
not
يعني.
open.
We can
Yeah.
send her, refer her to headache clinic. Like we refer you to headache clinic for follow-up for this type of headache. If there is anything happens, they will be following you. If they think at any time there is anything happen at that time, if you need more investigation, they will gonna go do it. So refer for headache clinic. I think it will be solution for this type of scenario. You save netting her by referring her to headache clinic.
It's not written in the task.
It's not about the task, it's about how you manage your patient. This is the things that they need you to understand that what you will do with the real life patient.
I think
exactly. I agree for this.
the only specialty is the mood doctor, I think.
The mood
No. It's your
doctor,
task also. This patient present with you now in a benign way. Okay. Maybe in the future she will present with another symptoms, which is alarming one. If you
Why you think she might present in the
why not?
future?
Why not? What do you think?
Like every person.
Like this, Dr. Basim, because now already she is alarming. This weakness is alarming. But it's
Alarming, yes. No need to tell her alarming symptoms
No,
or
not
safety
alarming.
netting.
Doctor, I am talking about something more serious. For example, she feels something
weakness.
different.
Doctor, and now she is
Like-
normal
Something
person.
serious
She
than the
is
paralysis.
physically normal. No need for red flags because she is normal, like normal person.
Okay, she's
No need
normal
for red
now.
flags.
I am talking about the future. If she has something different, like feeling double vision, something different
Why
than
we
the
will say
presentation.
this
This
to a
will
normal
be
person?
with Dr. Basim.
Because
Can you give me
everything might
time to
happen.
talk?
Everything might happen, Dr. Marwa. Now she's fine, nothing abnormal, right? Maybe she will have space occupying lesion in the future, which is not related to the main disease.
we say red flags هو يعني معرضين ان هم يحصل لهم حاجه نقول لهم الريد فلاجز بتاعتهم.
Any normal human, he can have any disease. I'm not talking about our
This will
condition.
weaken your justification, Dr. Basim, that no need for
No. I'm against
MRI brain now.
No. Yes,
Weaken
I will not
your
do now because your
justification.
weakness is clinically diagnosed. It's not something serious. Doesn't need unnecessary test. But if you have different, like any alarming for tension headache, the patient presents with tension headache, you are not giving.
As someone said here in the scenario, I don't know whom. If you told me that now you are okay, no need for more investigation, but in the future, if you feel any alarming symptoms like kida, I will say to you, if I am in her position, I will say to you, yes, I have these symptoms, doctor, because I'm not stable now and I am having.
We can solve this simple as I
يعني
said to you.
her
We need to give her a safety net. At the same time, we need to give her safety net, and at the same time, we don't need to worry her. We can just refer to headache clinic. It is
yes,
solving
because
the
of
issue.
her mental state now not stable, need to assist it.
But the mental state, why she's not mentally unstable? Because she's
يعني
stressed, or there is symptoms of we didn't explore that she's depressed or something that indicate. I don't know why we are referring
conversion
her to
disorder,
mood.
because of conversion disorder. It is conversion disorder.
Okay.
Okay, it's
The type of symptoms.
up to everyone. But I prefer for any case with my benign symptom to give her safety netting about the malignant symptoms. That's it. You can follow this approach or you don't follow. This is my advice. And I prefer to do safety netting for any symptoms in the communication scenario. It helps you to gain marks because this is at the end and the closure of the scenario. You will not talk about it more. Maybe 2 minutes left. You can give her this safety netting. Please, if you feel different sensation, different weakness, different presentation, visit us. Don't hesitate to call us. Why? If this patient have headache and it was serious, and unfortunately she had hypertension, for example, and this hypertension complicated with subarachnoid hemorrhage, and she will think that it is tension headache. I will not go to the ER. I will not go to my GP because this is what he already mentioned to me. This is tension headache. I will not go. I will not go until she will have, for example, severe bleeding. She might be in coma, seizure. Maybe she will die. Who will be blamed? You, because you didn't give her some red flags. If you have serious headache, which is the worst headache ever, please don't hesitate to call us. I'm not saying something bad. I'm saying some advices to the patient that she can get some medical advice if she feel abnormal than what she presented with right now.
Yes.
Yeah, to be honest,
Before,
Dr. Basim, really nowadays they insisting in this safety netting.
yes.
Even in this,
But you remember the case for vasovagal? You should give your patient safety netting because he is or she was insisting on doing imaging. Tell her there is no red flags in your condition, but if you feel 1, 2, 3, This
Yes.
is not
Mm.
benign. It may be malignant if you feel any focal neurological deficit, any fits, any weakness, whatever. So to discriminate between vasovagal and the other more serious. And the
Yes. Yes.
same was globus hystericus patient. It's the same functional disorder, but you tell him if you started to lose weight, if you start to have some bleed,
Exactly. Yes.
that.
By the way, I had the scenario of irritable bowel syndrome, and it was scenario patient refused to take enema because of embarrassing feeling. And I said to this patient, it was medical error, clear. I finished the steps of medical error, apology, and they admit, and so on. At the end, at the 2 minutes left, I told him, please, whenever you feel like you are passing blood more than expected, or you passing blood even in the stool, or you feel losing weight, as Dr. Dina said, or you feel something abnormal in your tummy, severe tummy pain, visit us. And I got full mark, adding to the medical steps of medical error. So it's very important to give this red safety netting. This is my advice again.
Yeah.
One has his option to follow or not.
Safety netting, nowadays it is important. Even if you want to discharge the patient from the hospital, you need to give him safety netting before discharge.
Exactly. I agree with this. Thank you, Dr. Any question or comments? Thank you, Dr. Mayada and Dr. Dina. Anyone has
Dr.
comment?
Basim,
Yes, Dr. Salma, go ahead.
I actually agree with you and Dr. Maida. I will tell something. So, in this situation that you mentioned now, if the patient develop something different completely, like subarachnoid hemorrhage, like anything else, and she didn't come because she remembered that you told her she's having conversion disorder and explained to her that her symptoms is due to stress. Then she anything happened to her, she will blame the doctor who explained to her this. She might also go to the court or say, here, you will create medical error later in the future. So that's why just touching the safety netting would be good. In the end of the scenario, concentrate on how to help the patient by giving her the relaxation technique. We agreed in this discussion, Mrs. Mary, that you have a condition called conversion disorder, that your symptoms related to your stresses in your life. So I recommend you to do some lifestyle modifications, doing more exercises, even yoga, relaxation techniques. And whenever you develop any symptoms different, any headache different than your usual headache, or any other symptoms different than your symptoms, please do not hesitate to come back to us again. Just full stop.
Yes, thank you, Dr. Salma. I agree again with this advices at the end, not as a main task. This is not your task, but at the end, while closing the meeting, you can talk about it. By the way, you can read any ER note, any emergency department note in any hospital. At the last 2 lines, safety netting educated or counsel to the patient about the disease and the red flags. Any scenario, why they want to be protected medically and legally. This patient, if left home and anything happened to him, and he didn't seek medical advice for any reason, because the doctor didn't give him these red flags, he might complain against the doctor. But once you explain to him about these red flags, you'll be protected. Whatever he will complain, already you mentioned to him how and when he can visit the ER again. Just remember it. By the way, you might not remember this point about red flag, but if you remember it, please and kindly do it. And believe me, you will get maybe the full mark because you close the scenario perfectly. Okay. Any other question or comment? Okay, thank you, Dr. Marwa, for being convinced, sorry. Dr. Hatem also agree. Thank you, Dr. Dina. Yes, thank you, Dr. Dina, mashallah. By the way, the surrogate are professional and ask a specific question. Yes, supposed to be. So not every question comes in our minds might be asked in the exam. Exactly. You might have certain points to be raised by the surrogate, and you might be discussed it in the meetings before or training. and might be not. So be ready to hear even one new concern which might be difficult to absorb for the first moment, but try to give a patient phrase like, I'm sorry for your feeling, I appreciate your question. While saying this sentence, try to think inside your mind, how can I address or answer this point? And take a breath, then answer him. Whatever the answer, try to skip and don't focus on it if you are not sure about it. If you are sure, take a time to explain and to talk. But if you are not sure, try to skip it and talk about it shortly, not for a long time. Okay, tricyclic antidepressant. I agree, Dr. Marwa. If she mentioned to you or anyone there is any medical option and you don't know, tell him you might have some medication, and we will arrange a meeting with our doctors. If there is some options, they will offer to you. If not, it will be by the best interest of your condition. So you are not here to prescribe. You are not the one prescribing for him. The mood doctor or the psychiatrist or the psychologist, they are the one prescribing this medication. So give the option, but don't give the medication. Don't prescribe. You are not the one. But you can still make the door open for such option. The last comment, attention headache. Yes, this is what I mentioned. Cognitive behavior therapy is very important. SSRI, yes. For the previous scenario, there was some comment. Substance misuse team. Okay, this is Dr. Osama. Thank you. Detoxification, of course, detoxification and rehabilitation program for any alcoholic patient. Stop alcohol totally or just decrease. Yeah, we agree. This patient have some infection, which is hepatitis C. It might lead to cirrhosis. Along with the alcohol, the trigger will be double, or the action will be augmented by the alcohol. So at least stop the alcohol totally, because the hepatitis C is still ongoing. Even after he finish medication and he's cured from the hepatitis C, that time only you can talk about alcohol, but within limits. If the liver is still intact, but if the liver cirrhosed or some extent of cirrhosis, definitely the patient is prohibited from alcohol. Should we discuss the patient about drug in details? No need. No need, Dr. Hatem. Drug already stopped, so no need to talk about them. And you have to believe the scenario. Once they mention the patient quit, no need to talk about something he already quit. Okay, thank you, Dr. Dina. Nice also to be with you in this session.
Thank you. إن شاء الله نلتزم بقى.
Hopefully. It's a good time in Egypt. 10 p.m. It's a good time in Egypt.
Yes, yes.
Okay.
We will have the summer time, the summer timing. It will change.
When?
Will be 10:30 or no 12:30. I think we will have the summer time next week.
Next week? Okay.
Yes.
Anyway, I think the night is shorter in summer, right? Night is shorter.
Yes, exactly.
Okay. Any question or comment, Dr. Dean, I want to add? Anyone has comment, please? He can comment.
Thank you. Great session. Thank you.
Thank you, Dr. Dean. Thank you. Dr. Marwa, Dr. Salma, thank you for participating today. Dr. Mayada, thank you for your comments. And next time, I promise you, next time it will be yours. Just remind me, or I will put it in my mind that next communication will be with you, because you wish to do the scenario today, but actually it was selected already by Dr. Marwa and Dr. Salma. So next time, inshallah, you'll do it. Any other comment or question before ending the session, sorry? If no comment, we can end the session. Thank you, everyone. See you tomorrow, inshallah, the clinical day, short clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.